Welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we bring this podcast to you every Wednesday as a veterinarian, as a technician, as a dentistry team to help you be even better at veterinary dentistry in your practice. We're sponsored and partnered today with the Veterinary Dental Practitioner Program. If you're interested in being among the best anywhere in general practice as a team in veterinary dentistry, I invite you to request an invitation. Just go to ivdi.org/INV, like invitation, first three letters INV. So IVDI, International Veterinary Dentistry Institute, ivdi.org/INV, and we'll get you the information that you need. Let's go down to Megan's question. What is your recommendation for a puppy who comes in with a fractured deciduous tooth? And the answer to that is extraction, and extraction that day, if possible, because that pulp's exposed. That pulp is huge, and it's going to get infected if it's not already. The puppy may or may not show that it's uncomfortable because they're puppies. They're not, 90 to nothing all the time. Nothing seems to bother them for the most part. And any things that they do, like rubbing their face on the ground or rubbing that side of the face, maybe just be perceived as puppy behavior. They're active anyway. And so it's not really picked up if they're uncomfortable, and those things can abscess and often do, and they go undetected, and the dog suffers until the body takes care of that and eventually resolves it after weeks. So always extract those, and always get pre-op radiographs to make sure you're getting all the tooth root, because some of those might be partially resorbed, and a lot of them will have apical to the mucogingival junction, or at the mucogingival junction, they'll have a fistula. You can actually see that fistula, but not always. That's when it breaks through the bone and affects the tissue. So yes, you want to extract those. So let's go to cases that have cysts. So we're going to talk about that now. And very common to see these, although you may not have seen them, probably because you're not looking for them and taking radiographs on every indication that there are, every indication that there is to take radiographs for finding these. So let me start off by saying, if you have a brachycephalic breed with a missing O5 or first premolar, upper or lower, and specifically lower would be the more common situation. Upper is super less common, but lower O5s in a brachycephalic breed, first premolar in the mandible, if that's not there, there's a really good possibility that there is a cyst forming or that will form. If this is a patient less than 18 months old, 2 years, you're taking radiographs, if there's no cyst that's forming yet, probably not going to be if you don't see it radiographically, but I would still follow it up in another year to make sure. But if it's an older patient, you don't see anything, if it's unerupted, it's not going to happen. But if it's less than that age, if you're there anyway, get it out. Because there's a good chance that that's going to progress. The crown is under the tooth, where the tooth's supposed to be, which is in the oral cavity. It's in the bone. There's an epithelial root sheath around that tooth that produces fluid. That fluid expands, and by 3, 4, 5, 6 years of age, you get tremendous bone destruction from the cyst. So you want to make sure that if you get these early, when the patient's less than 18 months old, go ahead and extract them, get them out of there before they have a chance to produce the changes that we see, and we see those changes that are really bad. So how do you prevent a fracture of the mandible during and after the procedure when you have a radiograph where the tooth is compromised, or the bone's compromised significantly around that tooth root. And Allison Marie asked that question. And so when you've got that situation where you've got a really significant decrease in bone, which would happen if you had a tooth that was partially erupted, that had a cyst in it. And if you're watching on YouTube or you're watching live here in the workshop, that is the radiograph that I've just described, where you've got significant bone destruction and there's very little bone left there. If you are doing this and you've got a lot of experience doing extractions of mandibular canine teeth that have that type of involvement, where the cyst has been associated with significant bone involvement, the canine tooth's involved with it, then it shouldn't be an issue, because you know how to do that without compromising the mandible. If you don't know how to do that, if you've not had experience with a lot of surgical extractions, know the anatomy, have the experience, then that significant bone loss is not something that you want to do. But from that statement, that question, Allison, may be how do we prevent it? We're really careful when we put our torque pressure on that tooth root to remove it, where we can't remove additional bone, where it's not feasible to remove additional bone because we may be compromising bone too far apically, and we don't want to do that in some instances. So we're just really careful. We don't put a lot of torque on those. We make sure that we're slow and deliberate with our technique, and same approach to root tips. Slow, deliberate, sustained extraction force with a luxator elevator allows us to have really good control over that, and really good control over not fracturing that mandible. So great question. And when we're dealing with something like that, where you've got significant bone, you may or may not be dealing with extraction of a normal tooth, normal canine tooth and associated with a cyst, but a canine tooth associated with a cyst that's not erupted all the way, then that tooth root is really far back in the mandible. Then that presents a situation that involves more bone just from the socket of the tooth, but it's still the same, right, as a real significant cyst that extends back to the second, third premolar or so, which happens when the patient gets older if these are left undetected. Again, back to that first premolar in the mandible that's missing, that you detect radiographically on especially brachycephalic breeds. And I don't want to specifically limit it to brachycephalic breeds, because it happens with breeds of any breed or mixed breeds, but specifically them, because they're at really high predisposition to that. So recovering following something like that is not a major problem. It's just like extracting those teeth and having a proper flap surgically that closes the area. These are, in brachycephalic dogs, more prone to dehiscence. Why? Because you have a huge tissue mass adjacent to the extraction site that's more, in these cases, again, if there's a huge bone defect that has to be filled, and in our case we use a jugular sample to fill that defect, a jugular blood sample. You can use a bone graft and blood, but we just use a blood sample, just as effective. But if you close that long incision that allows you to get into and get all that cyst material out and extract the teeth that you need to extract, then that's a bigger flap, and you're doing it in a brachycephalic dog. And guess what? Especially in boxers, you got that huge boat paddle of a tissue mass or tongue that's laying up against that extraction site, and it's moving back and forth over that extraction site, and it's heavy, and it's placing downward pressure on it. So that makes it more likely to dehiss, and I have had a couple of those over the years in boxers that have dehissed. And if we have dehiscence, generally it doesn't pay to redo those. We let them heal by second intention, which is not ideal. It takes longer. It may be uncomfortable for them for longer, and it does require antibiotics for a short period of time, usually a week, and then that fills with granulation tissue, and it's actually imperceptible versus what it looked like, what it would look like if the sutures were there. It's just not ideal, obviously, with primary intention healing if that suture pattern stays and there's no disruption by dehiscence. So the recovery for that, if it doesn't dehiss, which is a very rare occurrence, a very uncommon occurrence, is like it would be for a mandibular canine extraction. There's really no difference. Elizabethan collar, analgesics for 3 to 5 days. We use NSAIDs. We might use a pain patch, depending on the extent, fentanyl patch, and so whatever your analgesics of choice are, multimodal would be the way to go with that. I hope you enjoyed that episode. If you'd like more information about the Veterinary Dental Practitioners Program, please submit to request an invitation at ivdi.org/INV.